opening of the country. First and foremost, as I have repeatedly said, when we were de-escalating the measures that were done, we did it with full knowledge that the figures were going to go up. The question is, how long and for what are you keeping the place locked up completely? The role of the government is to ensure that everybody is aware of what they ought to be doing in order not to get sick. There was pressure. The same people who are here saying whether we made the right decision to open up are the same people who, prior to the 6th, were also telling us we are doing a very bad thing for locking up Nairobi, Mombasa, and the other counties. The same people. The same Musa, the same Musa group. Now, so the issue is that are we noticing anything more than we expected? And the truth is that we are not. This is exactly the modeling that was done. These are the figures that we expected. And we were hoping, just like it is the case today, that we are going to continue seeing a majority, over 90% of the cases being asymptomatic, which then informed the decision of home-based care as much as possible. And as Dr. Amoth is responding to the question that you asked, I will also ask him to touch on the matter of home-based care and how to take care of people when they are at home, and who is allowed to go home and take care of themselves at home. But that is the way to go. Home-based care, for sure, is the way to go. The private labs that have been asked, it is true that there is one lab, specifically Lancet, which is the one that carried out these tests that you are talking about, that eventually turned out negative, from positive to negative. I think it is also the same lab that had also tested another group of people in Nairobi, which also had the same circumstance. The same thing was noticed. So it is not the first time. So what I would like to urge is that if you are hearing from people, the ministry will take its measures. We have asked our board to review that particular laboratory and see what they come up with. But what I would like to urge is this. If you've been hearing that a lab has got all these unclear results, don't go there. Usiende huko. Why are you going for a test that you know, to a lab that you know has been giving information that may not be clear? I understand that as a government, as a Ministry of Health, we have a responsibility to ensure that the laboratories that we are licensing are those that are carrying out and working in a believable manner. And it is so important for us to keep people informed in such a manner that is true. Because the worst thing that we can do is have a situation where people question the results that we give. So I would like to confirm that, yes, we have asked the medical board to look at some of these labs. And where we believe that a laboratory is not performing in accordance to the rules, not adhering to the standards, then definitely we will close them down. But let me ask Dr. Amoth to respond to